Hi, I'm Dr. Chuck. Today we're going to be talking about bad breath. Do you have it? Does somebody you love have it? What can you do about it? Well, stay tuned. We'll find out.
Your smile is beautiful and possibly deadly. Dr. Chuck is here to tell you how your mouth can hold the key to your overall health. Now, about that filthy mouth of yours.
Hi, I'm Suzanne Lynn with Dr. Chuck Reinertson, and welcome to Your Filthy Mouth. We're so glad that you're here.
Yep.
So much information to share, and today it's going to be maybe a little personal. It's about bad breath. And if you have it, maybe someone you love has this. Dr. Chuck mentioned, how do you know, first of all, if you have it? And I came prepared. Hold on. So it doesn't have to be the fancy stuff, right? It can be the generic.
Well, it all depends what the goal is. You trying to mask the breath or you trying to take care of it?
Ooh, that's a good opening. First of all, how do you know if you have it?
Well, sometimes it's hard for a person to know if they have bad breath or not. It's like a smoker. They don't smell the smoke. Mm-hmm. And sometimes someone with bad breath, halitosis, doesn't realize they have bad breath. Well, that's one thing you can do. Another thing you can do is lick your wrist, let it dry, and then smell it. That's another thing.
So wait, I have to lick your wrist?
No.
I got it. Okay.
Or you can ask someone you love who's going to be honest with you. And sometimes people have a hard time being honest with you because they don't want to offend you, but you'd much rather know if you did or didn't.
Yeah, absolutely. So you lick your wrist, wait, and see if it smells. What about sneezes? Sometimes when somebody sneezes, you can smell.
Well, you can see exactly. Yeah. So what's coming out of you? Does it smell good? Does it smell bad? And sometimes, again, you may have to ask people that you love, that care about you, do you have it or don't you have it?
Mm-hmm. Wow. All right. So what causes it?
There's a lot of different causes for bad breath. The number one reason, though, is oral infections, bad home care, not brushing good, not flossing good, not keeping the mouth as clean as it should be. That's the thing right there. I know my soapbox is really on what's going on behind the curtain of the lips, and there's so much that's going on that you just don't see, and if you don't see it, you're not going to pay attention to it. If you had a wound, you'd want to clean up that wound, let it get healthy, and it would become healthy and go away. If you don't see it, if it's going on back here, you don't see it, it still is going on, and now you've got the pus, the other stuff coming out, and you wonder why you have bad breath.
Sure.
So
that makes a lot of sense.
Yeah, it's coming out of the mouth. So, but that's one of the reasons, one of the causes for it. There's a lot of other possible causes that you have. And in fact, we have a whole list right here.
Okay.
Yeah, tobacco. That's a list for some people. It masks the bleeding of gum disease, but it's really bad for the overall oral health. Smoking is a bad thing.
So it's not just bad breath because of the tobacco or the cigarette smoke. It's actually encouraging bacteria, which is the bad breath.
You've got more gum disease going on, then you have more bacteria. You have it just keeps on getting worse. Mm-hmm. So certain foods that you eat. I mean, if you have onions and garlic, things like that can affect your breath. Dry mouth.
Dry mouth. Why?
Dry mouth. Well, you don't have the saliva to dilute the acids that the bacteria are producing. Now you've got this kind of a cakey buildup in here, and the saliva isn't there to flush things out, to keep things clean. There's like 400 medications that'll dry out your mouth. So This is a common thing. So dry mouth is not a fun thing, but a side effect of dry mouth is bad breath.
Okay.
So dental hygiene. That's the first thing we talked about.
Right.
Man, take care of your teeth. Keep them good and clean. People talk about brush your teeth. No. Clean your teeth. Clean your teeth.
I see what you did there.
Okay.
All right. That's different than just brushing because there's
brushing
a lot more.
is part,
right.
but we have to get in between the teeth. Whether you use dental floss or those little picks or water irrigation, there's more than one right way, but there's a lot of wrong ways too. Mm-hmm. So you got to clean your teeth. Mm. Another thing for bad breath: crash diets. Okay, you get on this diet, you're going to lose a lot of weight in a hurry. Well, that can affect the way your body is metabolizing food. You can go into ketosis, and people in the keto diet, which is, I'm not going to knock it, but you can get into ketosis. That can give you bad breath. So sometimes you think, gee, am I not cleaning my teeth good enough? No, let's look at the diet that you're on. Mm-hmm. That can be a factor in it right there. Certain drugs can affect your breath. They come out in the breath. Of course, we already talked about certain drugs that can dry out your mouth. So there's a whole lot of issues with dry mouth and the effects of other drugs too. the mouth, nose, and throat conditions. If you've ever seen anybody that has, you might know, called tonsil stones. Those are those little white stones that get into the tonsils way back there. Some people have them. Other people never seen them. Well, the people that have them know about them, and a lot of times they can smell. Huh. And so you're breathing out. So again, cleaning out those tonsil stones, that'd be another thing you can do. Foreign bodies. Some people will aspirate certain things, and that can give you bad breath too. So there's a lot of different things, but the number one thing, just keeping a clean mouth, good, clean, healthy mouth.
That's where we were going. What do you do about it?
Yeah.
And that's like by far, all those things that you listed, but by far the number one is just keeping a clean mouth.
Well, a lot of people will do what you pull up the mouth rinse and say, this will take care of my breath. Well, you're masking it, you're covering it, but are we really getting to the source? And that's what we want to do, is we want to get to the source of the bad breath, not just cover it over with a Band-Aid.
So what about it says kills germs that cause bad breath, plaque, gum disease, gingivitis, like Listerine and stuff. I mean, is that killing the bacteria, or is that not what it's marketed? It's not as good as what they're saying.
It can be one of the steps involved in getting a healthy mouth, but it's not the end all. A lot of times people think, I'll just swish with this and that'll take care of it. No, it takes a little bit more than that. You actually have to get in there, and what I recommend is 5 to 7 minutes, one time a day. You got to really get in there. You can't do it in 30 seconds. So when you're cleaning your teeth, take that time. It's gonna help your breath. It's going to help your breath. So what are the things, some of the things you can do? We already talked about brush your teeth.
Right.
That's really good. Floss, get in between your teeth, get the bacteria out. If you've got dentures or partials, you can build up tartar, plaque, calculus on the dentures or partial. It smells. You can get it off. A real easy thing to get it off with is soak your denture or your partial in white vinegar for about a half an hour. Very
White
inexpensive.
vinegar is the key to everything. You got a stain.
White vinegar, yeah.
You got a dent in your car, just throw some white vinegar on it.
It might work. It just might work. But you can put that in there, and it's safe to do it. You don't want to leave it in overnight for just about a half an hour, then take a brush, and all of it comes right off. It's easy. What I like for patients to brush their dentures and partials, Cascade, automatic dishwasher soap. The liquid, squirts them on there, brush it, look at it, make sure it's clean, put it in water overnight, and you're all set. It's a fraction of the cost of some of the other things, and it works just great. In fact, I had a lady one time. It worked so good on her partials. She called me up and said, "Doctor, it worked great on my partials, so I used it in my mouth." I said, "You used the Cascade on your teeth?" She goes, "Yeah." She goes, "Now my mouth is on fire." I said, "Don't use it. That's not what it's made for. You've got to read the label."
That's the overachieving patients.
Yeah.
Don't they just drive you crazy?
She got better and things were fine, but it does work really well.
Yeah, that'd be poison that you're putting into your mouth. So, the interesting thing is, of all the things that you listed there, none of them said extensive dentistry is needed. These are all pretty easy fixes and cleansings.
Well, you've got the healthy mouth is the goal that we want to have. And if you do have some issues going on, you want to get those taken care of.
Right.
But you don't need a Hollywood smile to have a healthy mouth. But you need a healthy mouth to have a healthy heart. And so when we're looking at this, it goes way beyond bad breath. That's just a symptom, In fact, for nurses, if they've got a patient that has really bad breath, rather than walking away from that patient, it'd be good to go up to that patient and find out what's going on, because is the health of their mouth affecting their overall health? And there's a very good chance that it really is. And unless we're looking, we have no idea.
Well, that's wonderful. We've got the question of the week coming up, and we'll get to that in just a minute.
Perfect.
Here's Dr. Chuck's question of the week.
Hey, Dr. Chuck, this is Tracy. What is tooth sensitivity, and why do I have it?
That's a good question. Tooth sensitivity. What do you say?
It's very common. There's a lot of different things that can cause the sensitivity. One thing is the bite. If you have a stone in your shoe and you walk around for a few days, your foot's going to be sore. If your bite is off just a little bit, if that tooth is getting bumped the wrong way, that can make that tooth sore. It can make sensitive to where you put something hot or cold on. That's sensitive. And all it is the bite. But you have to find that. You have to be able to find where is that bite on that. But that's one thing is the occlusion, the bite.
You would say that's the number one thing, though?
No, not necessarily,
Just one of the
but
things.
it's I'm going to say it's pretty high on the list.
Okay.
There are people that I hate to say it, but there's sometimes having root canals done on teeth that was the bite issue. If they would have just taken care of the bite.
Oh, that's heartbreaking.
Yeah.
Not just because of the pain, but the money.
Well, it's and you want to from the dental side, I'd rather keep that tooth good and healthy with the blood supply going to it rather than removing that. Nobody wants pain. So
Right.
the reason you have the root canal done is so you can get rid of the pain. Well, let's find out, why do you have the pain? If it's caused from the bite and you can eliminate the bite and the pain goes away and the tooth is healthy, that to me is a better result than doing the root canal. With both of them, you're going to be comfortable. But with one of them, it's going to cost you a little bit more and the tooth is going to be a little bit weaker. So I'm not saying that all root canals are caused by bites by any means,
right,
okay?
but it's just,
But
hey.
you need to be aware that that is a factor on that.
Okay, other reasons for tooth sensitivity.
A lot of times, some of the toothpaste, the whitening and the tartar control toothpaste, those are two.
Preach.
Okay.
Yes. Right on the gums.
The way the tooth is put together is we have, especially on the root, you have different, they're called microtubules. They transmit nutrients through the tooth from the inside to the outside. Well, on the outside of the tooth, those microtubules are supposed to be clogged up. Okay.
And that keeps it from being oversensitive.
That's correct.
Okay.
Some of the whitening or the tartar control toothpaste, they have chemicals that unclog those tubules, so it makes it more sensitive. Okay, and so I just started using this toothpaste, and now my teeth are sensitive. Well, okay,
But they're really white. Right. You have to choose.
I just can't show them.
Right.
But if we can then use a different type of a toothpaste, the sensitivity type toothpaste, they have chemicals that reclog those tubules on the end. It may take 2 or 3 weeks of using it,
Okay.
but you can eventually reclog those tubules. Now, if you keep alternating between the whitening toothpaste and the sensitivity toothpaste, you're never going to get there.
Right.
I mean, it's always
They're
going to
be like, what do you want?
Yeah.
What are you trying to achieve here?
So you want to continue using the sensitivity type toothpaste. It may take a few weeks, but that sensitivity should be going away if that's what was causing it in the first place.
Okay.
Now, if you have a leaky filling, if you have a cavity going around an existing restoration, you could get sensitivity from that. So there are other things that can cause a sensitivity, but really high on the list is the toothpaste that you're using, also the bite, the way that's coming, and the last thing I would say would have to be just decay going on the tooth. And if there is, get it taken care of. It's only going to get worse.
Great question, Tracy.
Yeah.
Thanks for checking in. You can go to yourfilthymouth.com and just push that button right on the website and ask Dr. Chuck a question, and we'll send you something if we use your question.
Absolutely.
It might be a bill.
No,
It'll be
no,
something
no,
nice.
no.
So, but thanks for checking in. All right. Well, today we're talking about bad breath and how you know you have it and what you can do about it. What are the 3 takeaways?
Well, number one, let's figure out if you have it or not.
Okay.
And so that you want to, if you think you do, ask someone who's really close with you and ask them, see what they have, whether you have that. The second thing would be to fix it. And that generally comes from good home care. That's the biggest thing we have right there. Work on your spend that 5 to 7 minutes really getting in there, cleaning your mouth. Rather than say brushing your teeth or cleaning your teeth, let's think about cleaning a wound, because that's really what it is. How would you clean a wound on your leg? Well, this is a wound behind the curtain of your lip, so you don't see it. So let's clean the wound on that. So that would be the
really good.
What do you do about it?
Yeah.
And what's the third thing? How can you fix it? Right?
How can you fix it? Yes.
How can you fix it?
I lost track. I'm like, wait, was that 3 or 2? All right, good. How can you fix it?
Spend that time. Get a diagnosis. See what's going on. If you do have some medical issues going on that could be causing it, find out. If you are diabetic, find out. Go ahead and get some of these tests and get some answers. But don't be afraid to do what you can do for yourself at home for free. It's so easy to focus on what we can't do. But I want to focus on what we can do, because what we can do is inexpensive and very effective.
Are we brave enough to ask our spouses and our partners and our loved ones and our children, do I have bad breath? No, I'm going to lick my wrist, and that's what I'm doing.
Well,
just
I
can't
think
do
it's
it.
worth asking. And if you really want to know, ask a kid. They're going to be honest with you, right?
Yeah, plus you have a mustache, Mom. Thanks. Wasn't asking about that. Hey, listen, be sure to subscribe. We don't want you to miss anything. We love you. And as Dr. Chuck often says, he's just the messenger sharing about this.
Yeah, I'm not the expert. I'm not the researcher, but we need to connect the dots. We need to understand just how important this is, for not just for our breath, but for our whole bodies.
Yeah. All right. Well, thanks for checking in. Yourfilthymouth.com.
This has been Your Filthy Mouth, a weekly podcast about how what happens in your mouth affects the rest of your body. This is important information, so please share it with your friends. Don't forget to hit the subscribe button on YouTube, iTunes, and all the other podcast sites. And drop by yourfilthymouth.com to ask Dr. Chuck a question or find dozens of links to information about oral systemic health. We'll talk to you next week.